Well, in our last class, we were talking about some issues that are specific to psychotherapy, and for the most part, we were talking about individual psychotherapy. Now, in your textbook, you go on to a chapter in which they talk about alternative modes of psychotherapy, and the way your textbook lists it is not quite the way we usually think of it. You'll notice on this slide, for example, that psychotherapy, when we speak of it, we usually mean individual, group, marital, or family. Those forms of intervention typically fall under the heading of psychotherapy. Then, when we talk about alternatives, alternative psychotherapies, those areas in your text that talk about psychosocial rehabilitation, prevention, and community psychology are more seen as the alternatives. Now, we're going to start, and we're going to turn our attention to group therapy today. And we have mentioned it previously, but not as much in depth as we're going to now. Actually, one can trace group therapy back to about 1900. But it really became a well-known intervention more starting in the 1950s, but especially in the 1960s. Group therapy began to get lots of attention. And there are many kinds of groups. There are, and they follow the theories. So you have analytic groups, you have client-centered groups, you have Gestalt groups, and you have cognitive behavioral groups. And ordinarily, if we're talking about the phenomenon of group psychotherapy, normally a group is led by a skilled and trained person. That is, a group therapist is someone who has really had significant training in that modality. And it's not uncommon that groups may have two therapists. And there are various combinations. Some groups may have a male and a female, some may have two males, two females, etc. It's also not uncommon that when you have two therapists in a group, one may be a person with professional credentials, and the other may be a student who is learning the skill of how to work in a group. And in fact, most of us learned to be group therapists by being in the group with someone who already was an accomplished group therapist, and we work with that person, we get to see how they operate, and we get supervised by that individual. And that's probably been the most common way that one becomes a skilled group therapist. Now, there also are groups that are perceived as having a very positive effect, and they're not necessarily conducted by someone who is really trained in the mental health disciplines like social work or psychiatry or psychology or psychiatric nursing. These are groups that are focused on simply trying to deal with one behavior or one issue. So, for instance, there are weight loss groups, there are assertiveness groups, there are consciousness raising groups, and there are groups that work with people who are struggling with a physical illness. For instance, there are cancer support groups. Now, with these kinds of groups, often the focus is very narrow, and the focus is not thought of as being traditionally therapy. Rather, these latter groups are very goal-oriented, especially like if it's weight loss. I mean, for example, your clear message that you want to help people to achieve a certain goal. In fact, it's even a measurable goal, quite a measurable goal, actually. The assertiveness groups, which have tended to be more for women, but aren't necessarily limited to women, but they are focused on teaching people who tend to perhaps be shy or to less express themselves how they can take a stand. And in doing this, usually you're also trying to help the person to overcome some anxiety that they might have over being more assertive. With the groups that are focused on, people who may have some kind of life condition, like a medical condition, the cancer groups. Often they're focused on, first of all, helping the person who suffers from the illness to be able to cope as best he or she can, to share their feelings with other people who are going through this, to find means of encouragement. Now also, sometimes those groups are actually for the families of people who have some serious illness. And it's to help the family to readjust. And if, say, the breadwinner of the family, or a breadwinner, if there are two breadwinners, is very ill, there are going to be very significant changes that are probably going to happen. Not only to the person who's ill, but to that person's spouse, to the family. So some of these groups are very helpful in allowing people to talk about these feelings of change, the concerns that they now have, and to hear from other people about how they're coping, and to really develop skills that will allow them to deal with what is a dramatic life change. Now also, there are groups that focus on some form of psychopathology, alcoholism, gambling, drug abuse. And often those groups are not run by professionals. And later we'll talk a bit, especially about Alcoholics Anonymous, which of course has been an extraordinarily effective group, and it is never run by a trained person. But I'm going to start by talking about very traditional groups first. I'm going to start with analytic group therapy. Now, analytic group therapy has really received only modest attention. One of the reasons being is that the people who began running group therapy, who were very analytically trained, tended to be people not trained in group dynamics. And so what happened in the group, in that particular intervention, is often the therapist would sit there and the therapist would get people to talk in the group, but usually the people would be talking about not only the symptoms that bring them to the group, but about their own personal histories. And the therapist, in attempting to bring out a lot of history, because the focus is on history, would kind of go from one person to another person to another person. But the focus often would be between the therapist and this person, and then the therapist and this person, the therapist and this person. It was almost like you were conducting individual therapy, but you had an audience. Now, for actually good psychodynamic group therapy didn't have to be, that stilted. But the fact was that often the people who did that kind of treatment got into that style, and it didn't become a terribly popular intervention. Now, client-centered group therapy, on the other hand, evolved really into a form of group dynamics. And it could include Gestalt interventions and cognitive behavioral interventions. So the base for developing group therapy more grew out of the client-centered model. And the key in group therapy is really for the therapist to work with the members of the group so that they can help themselves and they can help each other to overcome whatever problems it is that bring them to the group. And ordinarily, in this kind of group therapy, you want to have some similarity in the patient population. So for instance, you wouldn't normally have a group where you might have 2 or 3 people who are terribly psychotic. Somebody whose presenting problem is that they're depressed because of a job loss, and somebody who is alcoholic. You don't tend to form your groups that way. You usually try to get people who have some similarity of problem. I think it would be fair to say that often groups have some similarity of socioeconomic status, because that does affect the resources someone has, and it does affect often the problems that they have and the ways they go about coping. but it wouldn't be unusual to have people from different socioeconomic groups in the group. Let's say if they're all trying to deal with depression. But there is, some of the power of the group is that since the people come from somewhat similar backgrounds, they more easily understand what each other is going through. Now, there are major benefits that come from group therapy. That is, group therapy, some people think of it, and it was proposed even by some, it's inexpensive. Inexpensive meaning for 2 hours of the therapist's time, the person can treat, let's say, 8 to 10 people. 8 maybe being more common. Well, if you can treat 8 people in 2 hours, it seems like that would be better than treating 2 people in 2 hours. Actually, there are very few professionals, in fact, today I don't think there are any professionals who really think that way. The reason you use group therapy is simply because it is a more effective intervention than using individual therapy. And there are certain benefits that you get in a group that you don't get individually. One of them being that the clients in the group get feedback on their behavior from other group members. This is a very powerful kind of intervention. And in individual therapy, if a person comes in and they present that they have difficulty making friendships, and you as an individual therapist say to them, well, I noticed when you came in that you seemed rather cold and you didn't respond very much to my greeting, and I wonder if it's possible that when you first encounter people, you kind of put them off. Well, often a very defensive patient will say, no, it's the reason why I was that way when I saw you is I was anxious and I was distracted. And by the way, you're kind of a cold person too. So, I don't think that's really the way I am. So if you're in individual treatment, you let that go for a while. But in a group, if the person says that, and the therapist might say to the group, well, why do you think so-and-so has a problem? And one of the group members says, well, you know what, when I first came into this group and I met you, I thought you really were cold. And I thought, you were someone I was not eager to get to know. And the person might say, well, I think you just didn't give me a chance. Actually, I'm really not that way. Well, some other group member will jump in and say, I actually felt the same way as the first person. When you came into this group, I thought you were very distant. In fact, of all the people in the group, you were the person I was least interested in getting to know. And I thought you would be least responsive to me. And then someone else will jump in and say, actually, I felt the same way. I don't feel that way now that I'm getting to know you. But when I first saw you, I thought, this is not someone I'm interested in. Well, when you think about it, that's a very powerful intervention. First of all, it's very hard to be defensive when you've got the whole group telling you, when on first impression, you are cold, distant, unresponsive. It's no wonder you have difficulty making new friends. It's no wonder you have difficulty in social settings. You send off a whole message that you are not interested in people. You send off a whole message that people should avoid you, and so they do. It can be so much more powerful, so much more therapeutically effective to have that experience in a group, especially when you have a therapist who is very supportive of the person and who can say then to this individual, I bet you're surprised hearing this. And often the person will say, well, I'm very surprised. And you say, well, perhaps we should ask, what is there that makes you think that you actually come across warm to people when we've got everyone here in the group saying that their first experience with you is that you really are kind of rejecting, that you put them off, that you're cold. And it's really striking in groups what happens, because often the person will say, I've wondered about that, and other people have told me this. Usually this is not the first time they've heard this. But I've always thought I really tried. And someone then in the group may say something like, and a supportive person may say, when I first met you and I asked you, what you did at work, you didn't tell me. Or you told me that you were a supervisor. And you did it so aggressively that I thought, I'm not interested in listening to this person. They're just going around and brag about what they do. And the client then who has the problem may say, I remember that. And the reason why I said I was a supervisor is, you look like somebody who has a very important job. And I thought if I didn't tell you something about myself that made me look like I have some importance, you just wouldn't be interested in me. And then the first person says, well, it wasn't that you told me you were a supervisor that was putting off. It's the way you told me. It was the aggression I saw in you. It was the coldness I saw in you. So maybe because, you're so frightened, you protect yourself by being cold, and you get across a very different message than you want to. And then the group will move along like on that theme. There may be another member of the group who will then, chime in and say something like, I always wonder how I come across when I first present myself. I feel I'm not very effective at meeting new people. And again, other members of the group might jump in and say, well, when I first met you, I thought you were very nice, but I noticed that you were very passive, and so I thought I would have to work very hard to get to know you. Our other group member jumps in and then says, boy, I'm sorry to hear that, because when I first saw you, you were one of the people I really wanted to get to know. So here you have this situation where a person is admitting, I really wanted to get to know this person, and yet the message they sent off was that they would be aloof, hard to reach, etc. And that kind of movement in a group, that is the interpersonal effectiveness, is something that is so much more powerful, and things can move so much quicker than if you were really seeing someone individually. Now also in a group, clients are able to test themselves in a social situation that's really safe. So a person who feels that he or she does not express themselves well in a group can really get feedback about how they might improve their skills. So somebody might be open enough to say, I just have difficulty meeting people. I just have difficulty in getting a sense of what do I do to come across well, and what do I do that puts people off. And in a good group, the members will be encouraged to give feedback to the person. Well, how does Mr. So-and-so or Ms. So-and-so come across, when they interact with you? And people often are startled by finding out that they're sending off messages that they never intended to send off. In fact, often they're sending off the opposite message of what they intended to send off. And then, that's where the therapist can then ask them to begin to examine, why would you send off a message like that you don't want to be involved with someone, when in reality you're telling all of us you really do want to be involved? And then, that's when people often become disclosing and saying things like, actually, I'm very frightened of getting close to people. I've often been, anytime there's an opportunity for a relationship that I think might become intimate, I get very scared. And then the topic may shift to people's feelings about intimacy, which often then touches a lot of other group members who will begin talking about that. So you've now moved from first impressions, and you've now moved from talking about, failing in making good contact with people, to talking about some of the dynamics about why one perhaps doesn't present oneself very well in a group, because one is already worried that it might work. If it would work, I might end up having to be intimate, and that really scares me. So I think now I'm beginning to realize, actually, I'm not trying to, it isn't that I don't want to get to know someone, but I'm very fearful if I get to know them, I won't be able to go any further. And so then you begin exploring, what does going any further mean? And that's a very kind of powerful thing that happens in groups. And if you see it happening, and for those people who experience it, they begin to feel very good. The key, of course, is the therapist has to be effective enough to be able to be reassuring to the people in the group. That is, if you're going to disclose important things like this, you have to do so without, having people say, well, one reason why, you're not, people don't really like to interact with you is because you're unlikable. Who would want to get to know you? You have to avoid letting hostility surface and rejection surface. You want people to find out that it is safe to bring up these very difficult topics and then to be able to talk about them. Now, and when that happens, you get the next issue, which is that clients learn they're not as alone in their struggle as they often think. That is, the therapist might say that in individual therapy, this person is saying things like, when I meet people, I just get so anxious, and people don't spontaneously seem to like me. And I so wish I could do this better. And when the therapist says something, an individual therapy says, that may not be as uncommon as you think. Typical client response in individual therapy is, well, it's easy for you to say that. After all, you've got a doctorate, and you make a lot of money, and you do this or that, and they really already know the therapist is married. So you're married, and you got a family. You don't really know what I'm going through. But in a group where you have peers, so some people are in very similar circumstances to others. And people begin to say, actually, I'm very fearful of making, social contacts, or I'm very fearful of intimacy. And I often think I'm the only one who feels the way I feel. And so when someone else says, well, I feel exactly the way you feel. I am scared, I worry, and in fact, I was in an intimate relationship about 6 months ago that broke up. The truth is, I realized it broke up because of me. I was very angry when the relationship ended. I felt this person was unfair to me. I felt very rejected. But as I thought about it, I've begun to realize that I caused that relationship to break up. I was too frightened to be responsive. I was too frightened to get committed. And the other person began to think I really didn't care when I did. And they left me and they got involved with somebody else. Another member of the group jumps in and says, oh, I'm really glad you said that, because that's how I feel. For a long time, I kept blaming other people for breakups in relationships. But I've begun to see that I'm the one who doesn't contribute when it really gets intimate. I am the one who gets scared. Now, that is so helpful to people who are struggling with, say, issues like this, because they're hearing they're not alone, that other people struggle the way that they struggle, that other people have handled it as badly as they have handled it. And then it leads them into and a good therapist will lead them into this, it leads them to start talking about what is the thing that happens that causes you to get so frightened that you begin to back out of a relationship, that you begin to become less responsive to someone else, that you begin to create a signal or a sense for the other person that this relationship isn't going to go anywhere. And then people can examine like what it is they do, and often they can come up with a lot of things. They can come up with things. They become less sexually active with them. They spend less time with them. They start arguments that they realize are foolish arguments, that really, we shouldn't even be arguing about this, but somehow we're arguing more. But all the kinds of behaviors that are signals that this relationship is deteriorating and that I am no longer interested in you. That is the message that's sent off. Now also in groups, especially in cognitive behavioral groups, it's not uncommon that after someone describes to the group something in which they're failing, they want to go in and see their boss. They feel they really deserve a raise, but they're just frightened. absolutely scared, and they know they really should be making more money. They know they're due for a raise. Their boss hasn't brought it up. They want to bring it up. The group might discuss a strategy for how the person might go about doing this. Might even go so far as to act it out in the group and to have somebody play the boss and somebody be our client here and approach the boss and talk about how you go about doing this. Let the person actually act it out. Talk about the anxieties that come up as they begin to approach the boss, and then develop a goal, that is a real plan, something that often is called homework, where the person leaves the group and then they're to go, and 2 days from now they're supposed to ask their boss, etc., and see how it goes. Then they come back in the next group session and someone will ask them, well, you were supposed to go and see your boss. How did that go? What happened? And if the person says, well, it was a bad week. I don't think it was the week to ask, so I didn't ask. And then members may say, and just how many more weeks do you think it will be that it will be the wrong week? Maybe we'll believe you if you go this week and you do what we suggested. On the other hand, maybe the person went and asked the boss, and let's say the boss said no. The company doesn't have it. We can't give anybody a raise. You deserve it, but we're not going to do it. And you might ask the client, well, how do you feel now that you've gone and taken this big risk? There's no reward. And that person may say, I feel great. It was so much of a breakthrough for me that I went and asked for something for me, that I'm beginning to think it was more important that I asked for it than that I actually got it. I wish I would have got it. But the big thing is, I'm not scared to do it anymore, and the world didn't end when I did it. So lots of stuff then comes out when you actually have a group that creates expectations for people and then gives people a chance to come back and talk about them. Now, it's not uncommon, when you have a skilled therapist leading a group, that the therapist begins to recognize, based on some of the history that they know about certain individuals in the group, that the person has begun to behave not the way you might expect them in the group, but the way they would in their family. That is, they have begun to respond to people with the same expectations that they described that mom and dad used to have for them. And when you point this out to someone, like, you've told everybody you have a critical older brother, and this patient, talks about that and then describes the social situation. And that is, you have in your mind the fact this person had a critical older brother. Patient is now in the group and describing a situation, and the situation they describe is such that they elicit a response from someone else in the group that, well, I think there might be a better way to handle this. The first person then says, well, that's why I don't want to be in this group. I bring up something and you're really critical of me. And all I get is criticism. Now, the therapist is sitting there realizing that actually the person who said, I think there's a better way you could do this, was trying to be helpful and actually was a rather empathic person. But the individual who made the disclosure, who has had this critical older brother that's bugged them all their life, here's every attempt to try to help them as being critical, as being negative. And so the therapist might intervene at that point and say, Jimmy, Al here really just said to you that perhaps there's a better strategy you could use, but you're treating Al as if Al was your older brother. That is, what you heard from him was criticism. Why do you think that is? And someone else in the group often then will jump in and say, well, I wondered about that because I thought Al was being very warm and very supportive, and you jumped all over him. And then the person will begin exploring about how every time criticism comes, they feel inside, they feel angry. And in fact, they see criticism when it's not there. So that even Al, who is this warm person, trying to help them to see there's another way you might handle the situation, ends up getting this guy's hostility. So of course, what is going to happen to this guy in most social situations? No one's going to give him any feedback. If every time you try to give somebody feedback, they get angry with you, you learn quickly. Don't talk to that person. So the person becomes socially isolated. These kinds of things are just, really powerful things that come up in a group. And, it's this interaction that that you encourage. And that's why when I was telling you in the beginning about if you operate in kind of a staid way, like some of the early analytic therapists did, where you just talk to one person, you talk to another person, you get a lot of history, you lose this dynamic of the group. And it's the dynamic of the group that we find to be, very therapeutic. And by the way, while group therapy in itself, is a very powerful force, groups are powerful forces. That is, all of us are in various groups, and we either, like them, we don't like them, or maybe we're indifferent to them. Like, I wondered, if we take ourselves as a group, are there any generalizations you would make about us as a group? I mean, when you think about it, you come here every day, 4 days a week, you're putting all this time in. Do you ever ask yourself things like, well, what's it like to be in this group? Are there any characteristics about this group that you would identify? Anybody want to offer me a characteristic about our group? Everybody's smiling. Now think about it. Any generalization you could make, any observation you could make. Sure, Mr. Inman.
I would say we're a pretty studious group. We have pretty good attendance. We try and offer questions and answers, and we all seem to take pretty good notes.
That's very good, sure. The group is studious. The group's cooperative. People are here and they're concerned. Those are very important characteristics, after all, if you're going to have a good group, to have people cooperating with the objective of the group. What else could you say about the group?
I would say that we're about half and half. We're either very, very quiet as individuals, or we're very outspoken as individuals.
Okay. So Ms. Hofstetter has divided our group into two. Those who are more verbally active and those who are less verbally active. Okay. And if you think about it, that's a fairly common characteristic in any group. Not everybody will be, as active as others. What you might want to think about in this group is, you notice, no one ever criticizes anyone in this group. That's a very important characteristic. It's a very supportive group. People seem to try to help each other. When someone says something, no one ever says, that's off the wall. Instead, people are more likely to say, that's a good idea. Okay, Ms. Bro, you've got a comment to make. So you're not convinced that some things aren't off the wall, eh? Well, the point I want to make is that, if you think about it, any group you're in has characteristics. And it also has a life. An observation I would make is, I suspect that people are more comfortable since they got their grades from the first exam. That, it was reassuring to know people are doing well. That when you're in a group and there's an unknown, like how am I doing, that does generate a certain amount of perhaps tension or anxiety. Once you realize, I'm doing fine, then, that brings a certain degree of comfort. And it may even, cause one to be more comfortable, allow one to be more active. And actually, if you think about it, since the first exam, we have many more questions being asked in class. The class is more active. And so you might want to, go back and say, perhaps we should have had an exam in the second week of class or something, which would have given people, more assurance. Yes, I'm doing fine in this class, and I can ask questions and I can do things. But the point I want to make is, in all groups there are dynamics. And if you are sensitive to the dynamics, then you can appreciate, whether or not this is a desirable group. You can also make decisions about what kind of risks can you take. And if you think about it, you can always take more risks if you feel the people you are with are supportive and caring, if you feel they actually would listen to you, and if you respect them. That is, if you think, I would like to know what he thinks. I would like to know what she thinks. That feedback is important to me. Okay, now I'm going to move you from the groups that tend to be of anonymous people, that is, people who don't know each other. They get to know each other because they get referred for group therapy, to groups where the people do know each other. And so we're going to talk about marital and family therapy. Now, these are both very effective interventions, and they've been widely used and are currently widely used. In terms of married couples, it became clear to therapists, probably more in the 1950s is when this started, that people in therapy could not change their marital situation without the involvement of the spouse. That is, people would come in and they would say, oh, I'm in a terrible marriage, and my spouse and I are fighting all the time. We're never sexual anymore. We don't like each other. We seem to argue more than we do anything else. In fact, we've even stopped arguing now. We just don't talk to each other. And you realize, well, this relationship is really troubled. But if this goes on for a period of time, and as you listen to the person, and the person seems to make some attempts to improve the relationship, but it doesn't work, you realize unless you get both of the people in and get a chance to hear what each person is experiencing and what really are the dynamics in this relationship, you probably can't help the person who's in your office. And that's especially true if the problems that exist really are interpersonal. And the choices, became, when someone says, the marriage is just going terrible, if you just keep seeing someone individually, the only solution may be for them to get a divorce. And number one, that may not be why the person came. Number two, that may not be the best solution, but it may be the only solution because you're not working with both people. So you get the spouse to come in. Now, most often in marital therapy, people themselves recognize this. That is, the couple comes as a couple. They've been referred by someone perhaps, but you start on day one seeing both people. That's the easiest way to do this because both people are identified as clients. Both people are identified as wanting to do something about the marriage. Both people are identified as probably contributing to the problem, and you can treat them as a couple. It's a little more complicated when you're seeing one person, and you come to the conclusion that that's not the best way to do this. That is, it would be better if I was seeing both of them. And when you bring in the other spouse, it's very important for a skilled therapist to immediately get that person involved in such a way as they're not attending therapy to help their partner. They are in therapy to help themselves and their partner and the marriage. And since the new person coming in may be somewhat frightened, feeling my spouse already has a relationship with this therapist, and maybe my spouse has been saying very positive things about the therapist, then the individual may feel, I'm going to be the outside person. Or he or she has already told the therapist a whole bunch of negative things about me, and I've got to come in here and defend myself. So the skilled therapist has to be aware of all of that and really help the person who is now entering this to not be so frightened. And there are, stereotypes that happen. For instance, if you're a male therapist seeing a male patient, bringing in the wife, she may feel, now there are two guys who are going to jump on me for what I do. Or if it's a male therapist seeing a female client, and the husband is brought in, and the wife has been saying things like, I wish you were like my therapist. He listens to me. He doesn't yell at me. He's better looking than you are. He's richer than you are. The poor guy coming in is feeling, that the therapist is not the therapist. The therapist is a rival for my spouse. So you have to be very careful to help this man to feel comfortable, to express those fears. You also perhaps have to help the wife to realize that what she has been doing is setting up expectations that the husband is to be someone he isn't, and to help them to really look at more profound issues in their relationship rather than perhaps the superficial things that I mentioned. Now, the key, of course, in this, when you have to do it the way I described here, that is, you're bringing someone in with someone you've already seen, you simply have to work to get across that the new person is not there to assist their crazy spouse. The new person is here as a participant in this therapy. Now, in marital therapy, interpersonal communication is really a major focus. And what you're often trying to do is to assist couples to come to some understanding of how ineffective they really are in the way that they communicate their real feelings to each other. And also, you try to bring out from people in a healthy way how they can tell their partner how disappointed they are. In some marriages where the marriage is not going well, and perhaps it has been good for a long time, but it's deteriorated, and there are any number of reasons. Rather than say that, rather than say, we don't seem to have as much fun as we used to have. We don't seem to do things together. We don't seem to talk the way we used to talk. Sometimes what happens is the spouse one spouse already anticipating this marriage is going to end. And that makes them angry. Begins to get angry in the relationship. And so what happens is you get a lot of arguments, but you never get someone really expressing a much more profound issue, and that is, I am so disappointed that our relationship has deteriorated. Now, had the person said that, I am very disappointed, I really want to be closer to you, the other person would respond very differently, likely, than if you say to the other person, you're really a jerk. I don't like being around you anymore. It seems to me you're always hostile. In other words, if you respond very defensively, you begin pushing the other person away. If you take the risk of responding with a deeper feeling, like that I'm disappointed, I'm frightened our relationship is going to break up. I am frightened our marriage is going to end. Often that leads to a very different kind of discussion. And if the person who is having those feelings, instead of really saying that, starts arguments and creates conflict, the other partner assumes this marriage is in deep trouble and we're probably going to get divorced. And the other person may feel disappointed also, but feels, well, what would be the use of telling my partner that I'm disappointed and I don't want the marriage to end when my partner's already heaping all kinds of abuse on me. So the purpose in therapy then is to try to get past what might be the defensiveness in the couple, what might be the superficial behavior in the couple, to see what's underneath. Are there legitimate problems? Certainly relationships have legitimate problems. Certainly some relationships should end, that they're not going anywhere anymore. But often the relationship shouldn't end. Often, if the people were to talk more clearly, if each of them understood better where each of them is right now, they would actually improve the relationship a lot. Now, In marital therapy, by the way, while you're focused on the relationship, that doesn't mean you don't learn the history of people. Often it's very important to know the history of both people because you find, as I mentioned to you in other contexts, sometimes people become frightened at a time in the relationship because the family had a problem at that time. Parents got divorced after 20 years. And let's say you're the female and you remember your mom was devastated. Dad, after 20 years and things seem to be going well, Dad just walked out. Like that's the perception. Now this person has been married 20 years. She's beginning to worry her relationship is going to end. Only she's not going to be like Mom. She's not going to let that guy just walk out and Mom be there devastated. So she starts arguments with her husband. The guy's not thinking of leaving. He's kind of surprised. I mean, why are we arguing so much? Well, actually, they're not arguing so much at all because the woman really thinks that this guy is horrible. Rather, all of these really painful, traumatic feelings from the past, all those, that awareness about what happened with Mom, about how angry Mom felt, how rejected she felt, how unprepared she was. And now this person is preparing herself for that. The problem is, this is not her mom's marriage, and this guy is not her dad. But if she continues this way, the consequences will be the same. After 20 years, she will end up divorced. So the marital therapist wants to know some of that history. That is, you want to be aware of, are there any things that could be going on with either of these people that may have nothing to do with this relationship, but boy, are they ever influencing what's happening. Now, when we move on in our next class, we're going to continue to talk about marital therapy. We're going to get into family therapy. And what I want to stress in this is that all of the examples I am giving and will continue to give have the dynamic that you have a group process going, whether it's the two people in the couple plus the therapist, whether it's a whole family, or whether it's the large group we talked about. But that dynamic is a different dynamic, and in some cases, a more powerful dynamic than what goes on when you just have a therapist and a client, though even there you could say you have a couple. For now, we'll take a break, and then we'll come back.